Traditional medicine has always been reactive to the symptoms and end results of illnesses, and that fails to address the underlying cellular, mitochondrial, and physiological changes that will lead eventually to disease development. The core issues for a large majority of illnesses could be a result of lifestyle factors, unhealthy food choices, sleep disturbances, toxic exposure to certain chemicals like microplastics or forever chemicals, and all these factors collectively will result in mitochondrial dysfunction that would result in buildup of free radicals, cellular damage, and eventually disease development. Now, today we're witnessing major leaps in preventive care and functional medical care, and that focuses a lot on the core issues rather than the end result. The goal of focusing on the core issues would be to improve the disease state at the root of the problem. There are many interventions today that are geared towards mitochondrial health. Certain medications resurfaced like methylene blue or supplementations like quercetin, but there are other simpler interventions like red light therapy, which we'll be discussing today. Red light therapy or near infrared therapy with a wavelength of about 600 to 1000 has shown to be able to penetrate the tissue reasonably well, and that affects mitochondrial health, energy production, cellular repair, and eventually control of reactive oxygen species, also known as free radicals. While it is super important to always pay attention to food, sleep, environmental toxins, and stress, interventions like red light therapy could be very helpful to repair previously damaged cells and mitochondria. Now, how does red light therapy work on the cellular level? There are different mechanisms that we know of how red light therapy could be helpful. There's a certain enzyme called cytochrome C oxidase that, under certain conditions, attaches to nitrous oxide instead of oxygen. And red light therapy can help liberate that nitrous oxide, opening the room again for oxygen, which will lead to what we call cellular respiration, or the breathing of the cell, which will lead eventually to better and more efficient energy production. Another way is through direct activation of the red light to growth factors, antioxidant enzymes, and certain anti-inflammatory mediators. Now, all these processes will result in pooling of nitrous oxide. And nitrous oxide is a known vasodilator, meaning that it will cause the blood vessels to dilate, leading to more blood flow to the area of exposure. And that leads eventually to better healing and recovery. So now, what are the benefits of red light therapy and what could it be used for? Let's talk about skin health and aesthetics. Red light therapy has the potential to improve wrinkles, acne, certain scars, and it has shown a lot of potential and promise in certain kinds of hair loss. These effects are mainly mediated by increased collagen production and reduction of inflammation. Nowadays, you can get red light therapy hats or helmets that can help with that hair loss, and they have red light therapy masks that you can put on your face. But the big whole body panels can be helpful in all these issues as well. Another big area is the metabolic health and performance. So red light therapy can indirectly enhance weight loss through mitochondrial repair, which will lead to improvement in insulin resistance, which we made a big video about last time. Now, red light therapy could also increase the oxygen carrying capacity of red blood cells, and that could result potentially in better performance and better athletic performance. Now, is it side effect free? Is it entirely safe? Although rare, side effects could occur with red light therapy, especially in light sensitive individuals. And there are certain skin conditions and autoimmune conditions that would render the person very light sensitive. So I would definitely speak with your doctor before you expose yourself, especially to a prolonged period of time to red light. Now, how often should you do the treatment? If you want to accomplish sustained long-term changes, you need consistent repeated exposure. There's no consensus on how often and how long this should be done, though experts have seen majority of the benefit happening at 10 to 20 minute intervals 3 to 5 times per week. Now, another question, where can you get red light therapy? So you can go to a med spa or a clinic and get some red light therapy exposure. You can buy a panel for home. But the problem is the market is flooded with these advertisements, whether for home use or med spas. So how can you tell if this is legitimate or not? So I compiled a couple things to look at and ask about to make sure that you're doing the right thing for yourself. First thing you want to look at is the wavelength. So the panels usually would have two forms of light. One is red light and one is near infrared light. The red light wavelength should be between 630 and 680, and the near infrared light should be between 810 and 1000. Now, another factor that you want to look at is called the irradiance, which means how deep can the light penetrate into the tissue. And now, obviously, the bigger the number, the deeper the penetration, and deeper tissues can reap the benefits of the red light. Now, if you want to shop around and you want to look online or you want to go to that med spa and ask these questions, if you're given vague numbers, vague answers, and nobody could specify these numbers for you, that removes a lot of legitimacy to these panels and these services, these two numbers. And so always pay attention to these two numbers. As much as it is hard to acknowledge, but there is something to the saying, it is too cheap to be true. So if you got that feeling that it is too cheap to be true, you're probably right. And as I always say, longevity is simple. It comes down to food choices, sleep quality, control of stress, and avoidance of toxic exposure. But sometimes when we're not ahead of the curve, interventions like red light therapy can be very helpful in repairing the cells and the mitochondria that were already damaged. If you liked this video and found it useful, like it, share it with your friends, and subscribe to the channel. And we'll see you next time.